Starting a student-run dental clinic can be a rewarding and challenging effort that can better equip today's dental students for a worthwhile career in public health dentistry. In the U.S., there are more than 108 million children and adults who lack access to dental care. However, student-run clinics can provide emergency care as well as preventive and restorative dental care to this population, while giving dental students real patient experience.
As a public health student, I really enjoyed the interdisciplinary learning that's been involved for dental students specifically. You know, it's a great experience to begin early from first and second year students to have those interactions with patients and kind of develop their relationships as well as gaining experience in the clinic.
Getting started on setting up a student-run dental clinic means bringing together faculty, volunteers, professional dentists, students, and other social service providers in the local community. It may at first seem a bit daunting, but with support from faculty and the local dental profession, a student-run clinic can become a reality.
For those students out in other schools who want to start a community-run clinic, I believe that my advice would be to just do it, to take that leap of faith, to get good counsel from instructors and from other students who have done so, to not go blindly ahead, but to interview and have good conversation with individuals that have already, so to speak, created the wheel.
There are a few different inspirations for creating a clinic. One of the big inspirations obviously was to expand access to care. Another reason is we wanted to give the students a more real-world experience. We wanted to allow them to run the front desk, sterilization, be assistants, be providers, do the lab work, run every aspect of the dental clinic, so it's a little bit more than what they get in dental school. Another thing we wanted to do along those same lines is get the first through fourth year students working together. So the first year students, although they're not providing care, they're in the clinic, they're doing the front desk, they're helping out, they're assisting. So while they're mostly behind a desk in school that first and second year, here they get that real world experience to really see what they're building towards in their education. And I think while all 4 years of students gain something different from the clinic, I think it really benefits those first and second year students because they get to see what they're building to. The steps we took to create the student-run clinic were a little different than other places might have been because we already had the infrastructure in place. So in UIC students' fourth year, they go out on rotation to off-site clinics, and that's as part of the curriculum. So Goldie's Place, when we were starting it up, we got to build upon that already existing infrastructure to allow the students to come here. So it's a little bit different. It's not part of the curriculum. It's 100% volunteer based. It's on the weekends. It's not during the week. So it is a little bit different. There are some different things we had to do, but essentially it was building the agreement between Goldie's Place and between UIC. And so it was students, faculty members, administrators, and the people from Goldie's Place working to put this all together. The student group runs 3 times a month, and they do 2 Saturdays and 1 Sunday. And we schedule 12 patients, and we see probably 9 to 10 patients. Working with a homeless population, we don't have a 100% show rate every time, so it's normally about 9 to 10 patients per session. In terms of the patients, we see everything here. I've seen people who are 24 years old who have no teeth, and people who have come in that have all 32 teeth but need all 32 teeth taken out. And I've seen people who have never had a cavity in their life and have perfect oral health. So in terms of the patient population, that varies person to person, but generally we see a lot of periodontal disease, a lot of decay, a lot of teeth that are infected that need to come out. In terms of the students, I think we have kind of the learning experience comes with, it's a more real world experience here. So at school, they have all their supplies. You know, they go to sterilization, pick up all their supplies. They have pretty much unlimited of whatever they need. If something breaks, they call maintenance, they come and fix it. If they run out of something, they have somebody to get it for them. Whereas here, since it's a community clinic, you might not have all the same supplies. Your burr block might be a little bit different than what you're used to, so you have to learn to work within the constraints of what you're provided here. And you also get a little bit, I think some of the cases that you have here are a little tougher. So you're going faster, you're doing different things, you're doing it in a different environment. And so the students have to learn to think on their feet a little bit more than they do at school. All of the dental students in the school do not rotate through here. This is a 100% volunteer clinic. To give you an idea of how many students actually participate in there, we normally have 80 to 100 students per year that come through and volunteer in the clinic. In relationship to that, the actual class size for a UIC class, I don't know what the exact number, but it's roughly 60 to 70 students per year. So we have well over a fourth of the school volunteering in this program. So it's a very large program, and I think the reason it's so large is because they get to do something a little bit different. Other organizations, they might get to go and talk about oral hygiene or work with children, things like that, which, it's all very valuable, but here they get that real world experience, and they get to use their hands, and they get to talk with patients, and they see the difference they're making when they come. My advice for students trying to start student-run clinics in other areas would be to just be persistent and keep trying.
As a fourth-year dental student, about 7 other students and I, we formed a committee, submitted a proposal to the dental school about starting a student-run dental clinic at People's Health Center. We met for over several months to formulate a policies and procedures manual. It was a tough, long process, but I think the biggest challenge was getting the health net who runs these clinics to approve of it, as well as our dean of the dental school.
To my observation, some of the challenges are that you have several different organizations that need to come together, network. Okay, we'll provide the facility, who's providing the insurance, who brings gloves, what materials do you use, who's going to be familiar with the instrument aspect of it, but you're going to provide the faculty. So just a lot of networking of delegation of responsibility between student organizations, things like that. But in the end, that's a big part of its beauty. I think persistence carried the day, and common goals and inspiration, and each facility had something to gain, and it wasn't necessarily the same thing. Ideally, People's Health Center was we'll accept one Medicaid patient. If you can get one Medicaid patient a Saturday to come, that might cover our staff, paying our staff time and a half. And whether that's happened or not is debatable, but I think they like the not honor or prestige, but they like the association with the school. They like to be we work with Indiana University School of Dentistry. We like to, as rounding out our experience for the students, we like obviously strong community involvement, so we had that kind of interest, but they're not the same. So everyone had something to gain, and I think that's what tends to drive it. My advice to students trying to start a similar program in their community would be to network.
Starting a student-run dental clinic is not without its challenges, but the rewards are worth the effort.
One thing I've learned is to have a lot of patience. It's been really an interesting challenge getting things organized because I'm in charge of making sure everything's running okay for our student-run clinic. I'm in charge of getting our dates lined up, making sure we have clinical coverage, like with faculty members coming in, making sure that we're communicating with the staff here at Goldie's Place, and that everyone's on the same page. There are a lot of things that have to come in line to even make a clinic session happen for us. I've also learned that you can rely on people, and they actually are able to follow through with what they tell you they're going to do, and that you're even surprised by what you're able to accomplish at the end of a clinic session. with the amount of work we're able to do in just a short span of time when we all work together. It's been really, really rewarding, very intense sometimes. It gets a little chaotic and stressful, but at the end of the day, it's just fantastic.
Some of the challenges to initiating the clinic were finding a location, but once that was identified, things went quite smoothly. I would say the most complex part is finalizing negotiations between the university and the agencies that you're working with. And that's often the situation when you're working in partnership with community agencies. Once you get past all of the legal pieces of it, the rest of it's pretty easy.
Dentistry came in with Dr. Bjork wanting to volunteer his services because one of the big challenges that faces our population working with the homeless is that they are missing a lot of teeth, and aesthetics do play a part in our society, for better or for worse. So they would start making all the steps towards, getting their life back on track, but then they still had this very blaring deficit of missing teeth or a lot of decay or just oral disease. And dental services aren't something that are offered in a lot of places, free dental services, in a lot of places throughout the city.
Securing external grants is an important part of this program that we didn't anticipate in the beginning. We have responded to a call for proposals from an economic development grant opportunity through a local bank. And through that, we put a dental spin on this and put forth the idea that people will become more employable if they have an appearance that doesn't include missing front teeth, especially if they're in the public eye for their employment. So we were able to secure some grant funding for what we call Healthy Smiles for Employability. And just within the last couple of weeks, we received another grant that is intended to help improve employability for homeless veterans who also have an appearance that wouldn't be beneficial if they're applying for work in the public eye. So grants help us to expand the program, definitely.
Some of the challenges we have faced are making sure that we always have the type of supplies we need to do our job the best we can. One way we address this is at the annual midwinter meeting, is to go around to vendors at the end of the meeting and ask them for their leftover supplies. For the couple years I've participated in this, they've been extremely generous, and I end up with a car full of stuff to bring back up here.
When we first started out, we only had about 3 or 4 faculty volunteers. So I think even today, the biggest challenge is getting licensed dentists to supervise the clinic.
Starting a student-run dental clinic takes cooperation, patience, and a desire to help others. The rewards for dental students are many, and their impact on an underserved population in their local community is tremendous. Just ask any dental student who has worked in a student clinic. It's an experience unlike anything in the classroom.
The student-run clinic has taught me a lot. It's taught me that, not every day is going to be perfect. It's taught me how to think on my feet and how to really interact with people, which has been valuable. Really, that's probably the biggest thing, is just how to think on your feet and how to talk to anyone that comes to the door.
I feel the most rewarding aspect here is working with the population that we deal with, the homeless community throughout Chicago. The things that we see here, you don't see in a regular general dentist office. We have some people who come in who need all teeth extracted, who need tori removal, which is like removal of the bone inside the gums, which is something you don't see at a general clinic, only with like an oral surgeon. So, the rewarding experience is getting to meet the clients one-on-ones, getting to learn about them and knowing what they've been through and the struggle that they've been through, and trying to make a positive change in themselves and just trying to do things in a positive aspect so they can have a better future.
Well, I initially got involved because I kind of wanted to be involved in the community and help this community over here. At the same time, I wanted to gain valuable experience in dentistry and do something good while I'm doing that as well. So it's definitely done that for me, and I couldn't be happier.
To learn more about student-run dental clinics, contact your AA-PhD chapter, dental faculty, and advisors, or contact the American Association of Public Health Dentistry at ahphd.org. Our thanks to the many students, faculty, dental professionals, and clinic administrators in the making of this video. Special thanks to University of Illinois Chicago, Goldie's Place and Dental Clinic, Indiana University School of Dentistry,